everyone. I want to welcome a special guest, Agnel, who is in the dental field, and I found you on social media. I think I found you on Instagram. I just started this Let's Meet series where I just take random people that educate within their platform and that love educating in dentistry. And I saw your content very interesting. I didn't really want to dig too much. And I'm so excited that you agreed to go live with me so that I can get to know you and ask you some fun questions. But tell me, what do you do? What how long have you been practicing, and what's your journey now?
So my name's Agnel Etienne. I'm just a kid from Elizabeth, New Jersey. It's nothing special about me. I spent most of my life in New Jersey. Then I got the opportunity to work out on the Navajo reservation in Arizona. Um, about 8 years ago, I packed up my car and left New Jersey and drove
Oh,
across the country, and hit the ground running once I got here. And 8 years later, now I am moving to go to dental school in Poland. And I'm excited about that journey. It's almost surreal now. Again, like I said, if you asked me 5, 10 years ago, you'll be a dentist and you're gonna go study in Poland, like I'd be like, you're absolutely insane. And so it's just really cool to kind of see where I came from and where I am now. Um, so yeah, and as of now, I'm just trying to bring positivity and give people advice on how to maneuver through life a little bit, and as well as in the dental field. And I like to share my story, what I've gone through, and hopefully that brings some kind of motivation, excitement, and joy, and peace to some people that hear my story and like, yo, if he can do XYZ, I can do XYZ. You know what I mean? So that's where I'm at now.
did you always wanted to become a dentist, or that wasn't really in the plan?
So I'll start from the beginning.
Yeah.
When I was 16, I had bit into a bagel. I was on my way to church and we were eating in the car, and I bit into a bagel and my tooth broke. I kind of felt the tooth in the bagel as I was chewing. I was like, what the heck is this
Oh,
hard thing? And so I took it out, and I was like, wow, there's a hole in my tooth. This is crazy. Couple hours later, extreme tooth pain, extreme, like, when people are like, yo, toothaches are the worst, that's
yeah.
exactly what it was. So my mom took me to the ER. They're like, you have to go to the dentist. They gave me painkillers, and then the next day, they took an X-ray at the dentist, and the dentist was like, it's either we save it with a root canal, which was like $1,600, or we take the tooth out, and it's like $200. In my head, I was like, Mom, let's just take it out. We didn't have money, we didn't have resources and stuff, so I felt guilty because it was kind of my fault. I was eating candy left and right every single day. And my mom was like, no, we're gonna sacrifice and we're gonna save the tooth. And so they did the root canal right then and there. And as I'm laying down in the chair, the doctor and the assistant are just like talking about their weekends. They're so super nonchalant about everything, and they're just working on me. I'm like, I had no idea what was going on, and that's what sparked my curiosity in dentistry. And around that time, like I said, I was like 16, and you get flyers in the mail from all these universities and stuff like that. And I seen a school that had a 3-year dental hygiene program, 4-year, 3-year associates, 4-year bachelor's program. And so I signed up for it. I applied, I got in, and again, hit the ground running, started classes, and started. Once I started clinic, that's when everything just clicked into me. And I was like, this is what I want to do. I was having a great time. It was fun. It was challenging. And that was it. And after that, I became a hygienist, and now I've been practicing for 10 years now.
So
So
you have a good amount of experience under your belt.
yeah, and that's part of the reason why I wanted to continue, because even now I work in the I used to work. Yesterday was my last day at work, but I used to work with a whole bunch of yeah. It was so bittersweet. I haven't cried that much in a long time. I'm gonna miss those guys.
Yeah.
Um, but every year they my job gets a new set of residents that finish dental school and they want to do their residency. So it's like a residency program. Um,
Oh,
I was working as one of the hygienists there, and one of two of the residents went to school in Poland, and they told me about the program. It was 5 years long, and it was way cheaper than what it was in America because the part of the reason why I went to Arizona was because I was in an extreme amount of debt. Hygiene school set me back, and then I, got credit card, all this stuff, and I added all the total, and it was $185,000 as a
oh,
23-year-old kid that knows nothing about life in general. Like I just got a job, and I'm like, okay, we got some money in my pockets. Now we can start, living life and stuff. And then boom, all this debt came, which followed with anxiety, depression, suicidal thoughts, you name it, the whole 9 yards. And I needed a big change. And then that's when I got presented with the opportunity to go out to Arizona. And that's when I had to literally build myself from the ground up because it's one thing to change your environment, but all your problems will come with you if you don't address it. And that's what happened. That's what that I had to pretty much put myself completely out of my comfort zone and start from the ground up. And now I'm in such a better headspace. I cleared up all the debt that I had, $185,000 cleared up,
wow.
and I grew as a man, as a friend, as a human being. It's been the most phenomenal 8 years that I've ever could have experienced in my life. And so now I'm going to the same school that one of my past coworkers went to, and it's going to be another challenge. It's different culture, different country, different uh,
Yeah.
education, everything. And now that I've gone to Arizona from New Jersey, it's kind of the same process. So I don't have that much fear going into Poland. It's more of excitement instead of fear. So I'm very excited to start everything. But yeah, that's pretty much the gist of
That is
my.
exciting. So kind of like you, I'm a dental hygienist by trade. So I've been a dental hygienist now for over 15 years. My dad basically introduced me into the field. He's a retired oral surgeon, been in the industry for over 20 years, worked in the dental lab space as a dental assistant. I've kind of worked my way up. I've taught, and I just really love dentistry. So kind of like you, I not once in my mind did I want to leave dentistry. Like
Mm,
my goal was never to pivot into something else completely different. It was
yeah.
always, where can I grow? Because I felt kind of like I had capped out. I don't know if that's how you felt as a hygienist.
Mm.
You kind of feel very limited as to what you can do, even with like expanded functions and all of the extra stuff that comes with that. But
Clinically speaking, yes, there was a ceiling
clinically
for me.
speaking, you're kind of like, okay, so I was a clinical trainer. I've done it all. And
Mhm.
I felt my brain wasn't really growing anymore. So I figured, okay, I have to make a few changes. I actually suffered from carpal tunnel when I got pregnant,
Oh,
and I had carpal tunnel surgery in both hands. So between that, having a child, and really trying to see where I can grow in dentistry, that's kind of where my mind went. And I eventually was applying a lot, a very long time until I figured, you know what, screw it. I'm going to get my master's. I got my master's in digital technology with a concentration in AI and business analytics. And I pivoted into the AI space. So I no longer work with patients, but I'm still in dental. I'm still in dental, and I still use all of my clinical background, my soft skills, everything I know within my field. But I also acquired $30,000 of debt. So totally get it. That part really is not pleasant.
It's
But
not fun at all.
do you know that your curriculum that you're going to be like, have you looked at the curriculum for your school? Do you know what
Not
you have, or
mm,
you kind of
Not
like,
extensively, honestly. I glanced at it, and I'm kind of a guy that just jumps into the pool, and I gotta swim. I gotta learn how to swim right then and there.
good for
Uh,
you.
because I don't. If I look at it, then I'm gonna start getting a little stressed out.
Yeah, yeah.
Yeah, like my brain is like, and I'm still here in America. I still have stuff to do here in America, so I don't want to get
You're probably
flustered.
you're
You know what I
probably
mean?
so preoccupied with everything that's going, because you said that you're moving too, right?
Yeah, I'm in the process of getting all my stuff out of my apartment. Right, like I have to leave by 4 o'clock today. So
Oh,
that's why I was like, yeah, it's a little
I gotta
crazy right
get this done so that I can move out.
now. No, it's okay. It's okay. I got time, and it's going a lot faster than I thought it was gonna go. So it's
That's
all good.
awesome. Did you, I'm assuming you sold a lot of stuff and
Yeah, I
you have to
sold a
move
lot
out
of
with.
electronic stuff, books I've sold. I sold my bed frame, and I'm
Oof.
just getting everything out as much as I can. And I'm honestly, when I go out to Poland, I'm just gonna have clothes, clothes and towel, and then a few personal items and stuff like that. And so, but yeah.
As a hygienist, that you've been in the industry for 10 years now, so you know how to read x-rays, you understand periodontal disease, you understand what to look for, you understand how to communicate with patients.
Mm,
You have such an upper hand going into dental school.
right.
What's nice about your experience is, and this is something I've always thought about, and I would like your opinion on it. So
Hmm.
I'm in the AI space, right? And I noticed a lot of the doctors that were coming in brand new with no dental experience, no background whatsoever, right? There's a lot of AI software that helps with, let's say, imaging, right? So
Hmm.
it tells them where hypothetically the cavities are, where the bone levels are, all of that information. So I feel like over time they don't really get to expand their knowledge of reading x-rays, because especially if they start in a bigger organization that supports a lot of that type of technology. So a lot of
Hmm.
my background is within DSOs, and a lot of DSOs adopt technology pretty fast.
Yeah.
And I noticed a lot of the doctors that were coming in, I mean, they were relying on AI a little heavier than they should. And the minute the AI wasn't working, or they kind of like second guess. But with
Mm,
your experience, I feel like, or when we look at x-rays, because we've been in dentistry for so long, and you've been able to train your eyes to see black and white and all shades of gray, and you're able to pick it up. I mean, AI is own it's now a superpower, because then you're able to really look, glaze, turn it on, see if you missed anything, and you could really use it to your advantage.
right.
What do you think about AI? Because now, I mean, obviously knowing what you know, plus going into dental school, you're probably going to be introduced to a lot of AI software that is going to potentially help you in one day, hopefully, opening your own practice. So what do you
Correct.
think of that topic?
I've seen a lot of softwares, mainly on like Instagram. Like it'll show you that, like you said, early stages of caries, incipient decay. It'll kind of outline it,
Yeah.
and it'll outline where the bone loss is supposed to it, where it started and where it was supposed to be, where it's healthy, where it's diseased, etc. It's really, really cool. And I think it's very beneficial for the patient to understand what's going on in their mouths. However, for the clinician or the provider, the doctor, dentist, hygienist, whoever, I think it's very good to start without AI. And I don't know if schools are doing it nowadays, and just jumping into using AI, and because you don't want to rely on robots to
Right.
to diagnose a human being. You know what I mean?
Yeah.
It seems a little counterintuitive. And just like when I was in hygiene school, they taught us how to
Hand scale.
manually develop
I
hand
was just
scale.
gonna say that.
I was
That
gonna
was
say that.
my ticket.
I
Yes.
was hand
100%.
scale first, We didn't
Yes.
learn the Cavitron at first. We didn't
No,
learn the ultrasonic
no.
scalers. So we learned all our hand scaling instruments so
Right?
that we can be proficient in those and then use the Cavitron as more of like an adjunct, even though we rely on it a lot now, but like
You had
I
to learn
always
basics and you had to
correct.
learn scale.
You have to start
Otherwise,
from the beginning. You got to crawl before you walk.
not most of it out. So what are you really hand scaling at that? I mean, you have to,
You
it's
have to.
100%. But that was exactly what I was gonna say. Yeah.
Mhm. You have to crawl before you walk, and even from a deposit removal aspect, and even radiographs too. They taught us how to dip the films into the developer and the fixer, and before that, I mean after that, they taught us the machine that does it for you
Yeah.
and dips it into and then now we learn the digital radiograph. So
I
it's
have
one of
another
those
one for
things
you.
because yeah,
But
because it's kind of like again, you have to crawl before you walk,
yeah,
and learning the basics makes you more proficient in using the more advanced technology. Put it
I
that way.
have another
That's how
one
I
for you.
see it.
So with digital x-rays, right? Now you kind of just follow along and it places wherever you place it in the mouth, you just follow it and it organizes it for you.
Yeah,
Where
mounting the radiograph.
remember back in the days when we used the dip method, okay, you would take all these x-rays,
Mhm.
process it, and now you had to actually remember to put the dot in the right place
Correct.
because if you didn't know and understand anatomy, then you couldn't really, you didn't know what was top or bottom, but learning it that way really, I mean, you can put a whole chart together. You don't
Yes.
need your radiographs to kind of organize it for you, at least not for people I think that have been practicing for so long. I think you're able to recognize the anatomy and you know exactly where it goes, where it belongs.
Mhm.
Whereas people that may have started in digital x-rays maybe rely on the fact that it's placed exactly where you're taking it and oh you
Yeah.
can retake it and there's no it's all organized, right?
I
So
remember in class for radiology, they handed us an envelope and they poured it out, and it was 18 films, and they were like, "Put everything in the right place."
yes.
We're picking up the films, we're filling for the dot and for the bump on the side, and then we're moving it around, and then we're like, "Okay, take a look at it, please, professor." And then you get a pass or a fail, and they wouldn't tell us what was wrong with it, and we had to go back and figure out what radiograph was in the wrong place, was in the right place. And it was challenging, but like we did it over and over and over again until we got it down to a T. And now it's like I can look at a radiograph and be like, oh, this whole crown is gone, but there's a
Yes.
root, and this root is super long, and then there's an incisor next to it. Okay, this is number 10 or this is number 7. I can look at radiographs and determine what teeth are in that radiograph, regardless of if there's huge decay, if the crown's missing, if the root tip, except and I owe it all to walking before, crawling before walking, put it that way.
Yeah,
So
so I agree.
yeah. So that's how I
There
feel
to
about the whole AI thing.
Yeah, AI is there to help, especially to show patients what's going on because they don't understand what you're looking for. You've been looking
Mhm.
at this for 10 years. They don't all they see sometimes is elephant feet, right? They just like, what is that? That's awful. They see the pano and they're like, what is that? That's
Yes.
terrible. But it's a great way for patient education, for them to understand what's happening and for them to trust the fact that yes, you know your stuff, but this is only like an adjunct, right?
Right.
So anyways, I am so happy that I have met you, and it's so funny
Oh,
that
thank
during
you.
like this process, and I know I talked to you like very briefly before this. I wish you the best of luck. I definitely want to follow your journey. You seem like such a genuinely nice person, and
You
there's
so much.
definitely a lot of nice people in the industry. You just have to lean on those people and stay true to yourself.
For
That's
sure. And
are my two
yeah,
cents.
I mean, you seem like a very pleasant woman as well. Like I had a great time talking. You can see me like I haven't stopped smiling the whole time because number
Oh,
one, you're a great person. Number two, I get to talk dentistry with people that are in the same field and they understand me, and it was a very, very pleasant experience for me. So I appreciate you reaching out, and I'm glad I had to go through all the DMs that people were sending me, and then I found you, and then I'm like, yo, let's do it. I'm
Hey, hey.
all for it. Yeah, exactly. I'm all for it. So I appreciate you reaching out, and thank you for this opportunity
Thank you.
to speak about dentistry and AI, and I will be in your corner for sure too. So I'll be there for you.
Thank you
And
for
thank you for
being
what you
such a
do.
great thank you for being an example like in the industry. I think a lot of people we have some people in the industry that are not like so great and they might be negative, but we don't need that, right?
No,
We
we don't. We
live in
don't.
this wonderful world that we share, and why be angry or upset or bitter when you can be so happy and just be grateful for what you do have and the things that are happening around you. So be happy. I hope everything works out really well with your move, and maybe we'll follow up with you after your first year of dental school. That would be so much fun to see what you're
Let's do
doing
it.
and
Please,
how.
let's do it. Please, let's do it. I'm
Let's
all for it.
put on the
Please.
calendar. Well, it was so nice to meet you. Thank you so much, and
The
we'll talk to
pleasure
you
is
soon.
mine, Maria. Thank you so much.